Hello, I'm providing privacy. Hi, my name is Yolanda. I'm a student from Muskegon Community College. Can you please give me your name and date of birth? Okay, awesome. And I'll check the band, and the band certainly matches that. Okay, so the reason why I am here is to perform an assessment on you. So that entails me listening to your lungs, your heart, um, your I'm going to assess your vascular. Do you have any questions before we get started? Are you experiencing any pain, any tenderness anywhere before we get started? Okay, do you have to go to the restroom or anything? Okay, so I've already gathered my equipment. I provided privacy in the beginning. The light is good so that we can see. Are you comfortable? Patient is comfortable. Okay, so those are the things that you want to do at the very beginning of your assessment. Okay, you want to gather your equipment. You want to look in your patient's chart to see if there's any information that you need to know prior to going in, and then you want to make sure that you go in, wash your hands, identify yourself, make sure you have the right patient, and then begin your assessment from there. So we've done all those things there, and now we're going to begin our assessment. So the first thing I want to do, and what you'll have to do in your test out, is identify the lung borders. So I'm going to give you a little bit information about the imaginary lines that is in your PowerPoint presentation that I have submitted to you online. But real quick here, we have the mid-sternal line that's located here. So from the sternal notch, which is here, this is your sternum area here, xiphoid process being right below here. And this will be here in the lab for you to practice with as well. So but you have your mandibrium here, you have your sternum here, and then you have your xiphoid process that's located there. Okay, so that's your mid-sternal line. Then you have your mid-clavicular line, right? Also called the mammary line. Okay, and it's called the mammary line also because of the nipple area. It runs along the nipple line. Then you have your anterior axillary line. If I turn my patients to the side here, I can identify the mid-axillary line, right? Right in the middle here it runs. You have your anterior axillary line, which is towards the front of the body, and then you have your posterior axillary line, which is to the back of your patient's body. Then you also have your vertebral line, right? That's right along the vertebrae. We call that the vertebral line. Then you have your left scapular line here, and then you have your right scapular line here. The lung borders posteriorly starts at C7, which is the that bump that's in the back of the nape there, and it goes along to about T10. So we count the ribs to T10. Upon inspiration, the lungs expand, and we could go as far as to T12. The anterior lung borders are mid-clavicular, so at the apex, approximately 3 to 4 centimeters above the mid-clavicular, and it runs down to about the 6th rib. Okay, mid-clavicular line at the apex, 3 to 4 centimeters, the inner 1/3 of the clavicle to the 6th rib. Then you have, see, that's the anterior, and then the lateral lung border would be at the apex, right? So at the very beginning of the apex of the heart, and it runs down to the 7th or 8th rib. Okay, so you would count those ribs and until you get to around the 7th and 8th, and that is your lung border, axillary. Okay, now after you've told me that in the beginning of your test out, then you can begin your assessment. And so the first thing you want to do is you want to assess the chest, right? So what are we doing with our assessment? We are observing our patient's breathing pattern. So we're looking at the breathing pattern. We're noting if the patient is having any difficulty breathing, if they're using any accessory muscles to breathe, if does their color look appropriate, What does their skin look like? Is their skin intact? So for this patient, skin is pink. The integrity of the skin, I don't see any open areas or any lesions of any sorts. Now I'm going to palpate the chest wall for any tenderness or any moisture, right? So before I do that, I'll ask the patient again, are you experiencing any tenderness in your chest wall area? And so once they tell me no, then I begin to palpate the chest. And I'm just kind of feeling for temperature. For this patient, they should be warm, they should be dry. I don't feel any moisture or anything I need to be concerned about, okay? And so now that I've assessed temperature on the patient, I can also do respirations on the patient. Normal respirations for a patient is between 12 and 20, right? So we're basically counting how many times this patient inspire and expire within so many minutes, right? They should have between 12 to 20 in 1 minute, okay? So once I've done that, then I can go ahead and move on to assessing the lungs. Okay, so remember in the presentation, the PowerPoint presentation, you're going to have to identify that you will hear bronchial lung sounds here in the tracheal area, right? So you hear those bronchial sounds in that area there, right? And what does that sound like? Loud, harsh sounds, right? When they take a deep breath in and out, you'll hear that in that area there, bronchial sounds. The bronchiovesicular sounds, you're going to have to note that they're in this area of the chest here. So if you can see there, that's the bronchiovesicular sound. And that's a moderate pitch, and it's loud, and you hear it both on inspiration and expiration. And then you have your vesicular sounds, right? And that's towards the outside of the chest area here, right? And those sounds are very low pitch, kind of soft sounds in that area. And you hear those with inspiration and expiration. So you're going to have to identify those sounds in your test out as well. Okay, and then we're going to actually listen to lung sounds. So you have your stethoscope here, and you have your diaphragm here, which is the bigger round circle here, and then you have your bell, which is the smaller round here. Okay, and so I'm going to clean them all, put them in your ears, and you're going to listen to lung sounds, and you're going to instruct your patient every time I place my stethoscope on your skin, if you could take a deep breath in and out for me, that would be awesome. Okay, and so I'm going to place my stethoscope, so you would take a deep breath for me in and out. I start in the brachial area. We don't move our stethoscope until the patient has fully expelled the air out of their lungs. We want to be able to hear a full inspiration and expiration of the patient. So we move our stethoscopes again, and we just follow the pattern as you have on your PowerPoint presentation. And remember, there is 3 lobes on the right, and there's 2 lobes that are on the left. So once we have assessed the lung sounds, then we are going to identify the lung borders, which we've already done posteriorly. So we've done that at the beginning. I don't really mind when you decide to do your identify your lung borders. Just know that you have to identify. So go into your book, make sure you have a clear understanding of where the lung borders are. Okay, so we've already identified T7 to T10. Expiration could be as far as T12. Okay, and so I'm assessing my patient's breathing. Again, for the most part, I've already done the front, back should be the same. I'm assessing the patient's skin, the color, noting if there's the integrity of it, if there's any open areas, any lesions. If there is any open areas or lesions, be sure to put gloves on when touching a patient's skin, just because you don't want to transfer anything that you may have on your hands onto their body. Okay, so make sure that you do that. All right, so breathing symmetrical on both sides, skin is intact. I'm going to go ahead and listen to the lung sounds before I do chest expansion test and tactile phreemitis test. So I'm going to go ahead and listen to the lung sounds posteriorly. Okay, so and listen to the lung sounds posteriorly. You can start over here and you're listening there, and you ask your patient to take a deep breath in and out before you move your stethoscope. Okay, patient. And you pretty much have already listened to your lung sounds on each side there. Okay? So you've listened to your lung sounds. They're clear and equal bilaterally. Now I'm going to do what they call tactile phreemitis, right? Tactile phreemitis is to determine if there's an obstruction of some sort within the lungs, because when we talk, if we put our hands on the back of our skin or even on the front, we could hear that vibration that's coming through. But if there's a collapsed lungs or if there's mucus there, then sometimes you will not hear those vibrations. So we're testing to see if everything is clear within those lungs and that lung expansion. So we'll direct our patient to say, every time I place my hands on your skin, if you would say 99, 99 each time that I place them there, I would appreciate it. Okay? And so I'm going to place my hands on their back, and if you would say 99, 99, 99, 99, 99, 99, and 99. So I can feel the vibrations coming through, and that's what you want to assess. So when you're at home, make sure that you can practice on, a family member, or when you're here in school, you can practice on each other, and you'll be able to hear what those vibrations feel like on your hands. Then I'll do the chest expansion test. Okay, so we want to make sure that the lungs are expanding, that there's no collapsed lungs. It should be symmetrical on both sides. So I'm going to take my hands, put it on at about T10. So remember C7, T10, right at T10. Just like on the PowerPoint presentation, hands are on the chest, on the posterior area, and then you're putting your thumbs in, kind of pinch in a little, not hard, very gentle, and then you'll ask your patient to take a deep breath. And when your patient takes a deep breath, both of your hands should expand together at the same time. So when they take a deep breath, they should open and close at the same time. Okay? And that is chest excursion, chest expansion. That's at T10. So once I'm done with that, I'm going to have my patient turn around here, okay? If your patient is laying in the bed, you'll have your patient sitting up as high as you could possibly, where they're comfortable, so that you can perform these exams. The next thing I'm going to do is assess the carotid pulses. So when I assess the carotid pulses, remember we're only doing one at a time, right? We never do at the same time because the patient could faint doing that. So we get into that groove, sternocleidoid mastoid, and right above that, right in front of that, we want to put our fingers there, just the tips of your fingers, because the tips of your fingers are really sensitive to pulses. You can feel pulses a lot better with the tips of your fingers. And so you go ahead and kind of feel for that pulse there, and it should be nice, and it should be strong. When I don't mean nice, because nice doesn't really mean anything, but it should be strong. You should feel a bounding, not bounding, it might be a little too much, but just a nice pulsating feeling on your fingertips there. Okay, and then once you feel there, then you want to feel the other side. And there is a grading as it relates to the carotid, and that is in your PowerPoint presentation. I put that there for you. Okay, so we assess the carotids one at a time. Now I'm going to start assessing the heart area. Okay, so we want to make sure that we are aware of the various areas of the heart. Okay, so we want to make sure that we know that there are 4 listening posts. So the 4 listening posts are the aortic, the pulmonic, the mitral, and the tricuspid, right? So we want to make sure that we know those 4 listening pulses. And we also want to know where the point of maximal impulse is located. So point of maximal impulse is located. If you go back to your PowerPoint presentation, you'll note that it's at the mitral, right? So it's right below here at the mitral valve, okay? So if we were identifying our listening pulses, we go to the sternal notch, right? This is the mandiburum here. You probably have your angle of Louis, which is approximately here, and you can feel, especially with this here, and again, this will be here for you to kind of feel when you have your practice test outs, and you'll come down and you'll feel the rib, the actual rib. You'll feel the intercostal space. Okay, that's one. This is the first rib, intercostal space. You'll feel the second rib, intercostal, and then you'll feel the intercostal space of the second. So the second intercostal space. That is where, if you were to sit your stethoscopes, you should be able to hear the aortic. Okay? So you put your stethoscopes there, and you should be able to hear it. I do have, we'll do this at the very end though. So I'll take this here, we'll feel here, 1, and then here, and then that's your aortic, okay? So you should be able to hear the aortic there, okay? Actually, let's see, I think I have this here. I am going to turn it on. Heart. We'll go, and let's see if you can hear it, okay? Turn it up a little bit. Okay, so that's your aortic at the second intercostal space. If I go directly across the street, I should hear the pulmonic. And on this torso here, you might be able to hear all the rest of them. Tricuspid. Oh, look at it. You have Erb's point, tricuspid. And let's see if I can get it. Here you go, you hear there. And then your mitral. Okay, so you'll get an opportunity to come in here and listen to these sounds. I can switch them up to make them sound very differently, and you can be able to too, but I want you to get to know what normal sounds like, okay? So that's what you're going to do. You're going to listen to the listening pulses. You're going to listen to all the different heart sounds, and be able to identify S1 and S2 with your stethoscope. Where would you hear the loudest sound? Either S1 or S2. Those are things that I want you to go and read and make sure that you understand prior to coming in for your test out. Okay, point of maximal impulse right here. Here's your mammary, right? Your midclavicular line right there. You should be able to see those as well as palpate. Sometimes you can. It depends on the size of the patient. You may be able to actually visualize it, and then you may not, but most often you can feel it, and sometimes you may not. That's a pretty difficult one to kind of feel there. Okay, we're also going to take an apical pulse. So what will happen is I'll be listening with my stethoscope. I'm sorry, you'll be listening with your stethoscope at the apical, and I'll be at the point of maximal impulse, and I'll be doing an apical pulse, and we're going to be counting for a full minute, making sure that those numbers are the exact same. Okay, so we're gonna do that in the test out. Okay. Now, once we've completed the heart assessment, we've done the lungs assessment. Now we're going to go down to the extremities. Okay, so we'll start with the upper extremities. Okay. So here's our patient here, and we're looking at the upper extremities here. Okay. And we're going to assess the upper extremity, right? So we're looking at bilateral arms, okay? And we're looking at the integrity of it. We're looking at the size. We're looking at the skin color of the arms here. Arms are pink. They are symmetrical. One arm, when I compare it to the other arm, they're equal bilaterally. I'm also going to palpate the skin with my hands here, and I note that the skin is warm and dry. I also am going to palpate the the pulses. So we have the brachial pulse that's noted here, and so we want to find that, and you'll get a chance again to practice where the brachial pulses are. Okay, and then you're going to feel for the other one to note if they are equal bilaterally. Okay, then we're going to move down, and we're going to listen for the radial pulse, right? So we're going to find that. You're going to learn how to do that. We'll find the radial pulse. Okay, and you're going to get the other side, and you're going to listen on both sides on the radial. Then you're going to go on the other side, and you're going to assess the ulnar pulses there. Okay, and so those are equal, +2 equal bilaterally, so you're going to have to know how to grade them. Then you also are going to have to assess for capillary refill, and capillary refill is just basically with the hands you're going to kind of turn the hands around, and you're just going to, like on the thumb area, you're going to pinch to see the color. So in my skin here, if I pinch it goes pink, it goes white, and then it goes pink. So you're checking to make sure that there's circulation through our patient's upper extremity. So you do both sides, and the circulation is good. And then we're going to assess the lower extremities, right? So we're pretty much doing the same thing. We are looking at the lower extremities, and we're assessing for size, the color. We're noting if there's any lesions or anything. We're looking at the hair distribution of the lower extremities. We are going to feel the lower legs and see what they feel like. They're warm. There's no moisture noted. And then we're going to assess the lower extremity pulses, okay? Now, on the mannequin, we can assess the femoral pulse, right? So the femoral pulse is on the inner leg here, thigh. It's difficult to to find. You're not going to do that if you have a partner. You don't worry about doing that on each other. You can do it on family member or someone that you know, but for purpose in school, you don't have to do that. But you will have to identify the popliteal, and so the popliteal is located. I like to have the patient really kind of sit on the side of the bed if they can. But then you basically are going to put your hand behind the patient's leg here, and it's right behind here to feel for the popliteal. So a lot of times we like to do them both at the same time to note if they're equal, strong, bilaterally, okay, and palpable, okay. So we'll feel there, and then we'll also do the dorsalis pedis and the posterior tibia. So with the feet here, you have your dorsalis pedis, and you'll get a chance to practice, and that's just basically taking your hand, if you can see here, and going right here in the top portion of your patient's foot here. And you're going to take both hands and just note where that pulse is. You'll be able to feel it again with the fingertips and feeling that, okay? And then the posterior tibial, you're going to take your hand. So here's the inner pulse here. You just take your two fingers here, and you're kind of feeling there for that pulse there, okay? So I'm going to take both of my hands here, and it's on the inner where my fingers here, if you can see them. It kind of holds into that little groove there, and you should be able to note any pulses there. So practice at home with your family members as well, so that you will know where those pulses are, okay? Femoral, popliteal, dorsal pedis, and posterior tibia, okay? Okay. So then after I've completed my assessment, I want to make sure that I thank my patient for allowing me to assess. I make sure that my patient is comfortable. I put the bed to its lowest level for safety, because you always want to maintain safety. You also want to make sure that you give your patient their call light. You can offer them also if is there anything that they need before you go. They need a drink or anything, because that was a pretty long assessment. It could be, a little bit exhausting to them. But whatever you have to do, you want to make sure that your patient is comfortable. So that is it. Thank you. See you soon.